Hush not, child, and don't cry. Your folks might understand you by and by. Just move on up toward your destination, though you may find from time to time complication. Bite your lip and take the trip, though there may be wet road ahead and you cannot slip. Just move on up, for peace you'll find into the steeple of beautiful people where there's only one kind. So hush not, child, and don't cry. Your folks might understand you by and by. Move on up and keep on wishing. Remember your dream is your only scheme, so keep on pushing. Take nothing less than the supreme best. Do not obey rumors people say, but you can pass the test. Just move on up to a greater day. With just a little faith, if you put your mind to it, you can surely do it. Just move on up, move on up. We move on up, watch out, we just move on up. We move on up, move on up. understand you by and by. Just move on up toward your destination. Though you may find from time to time complication. Bite your lip and take the trip. Though there may be wet road ahead and you cannot slip, just move on up for peace you'll find. Into the steeple of beautiful people where there's only one kind. So hush not, child, and don't cry. Your folks might understand you by and by. Move on up and keep on wishing. Remember
Right.
your dream is your only scheme. So keep on pushing.
Hello? Can you hear me? So, don't have a guest, so try to abbreviate it. I think we got a couple of questions in there. And so you sent me one yesterday.
Take nothing less than the supreme best.
Gotcha.
Do not obey, no must people say, but you can pass the test. Just move on up to a greater day. With just a little faith, if you put your mind to it, you can surely do it.
All right, welcome to the town hall. We are looking at Facebook Live and seeing people log in, Facebook, YouTube, Instagram, Twitter. We got you all out there. So just making sure we got everybody online, giving everybody an opportunity to log in for just a second. We are good there. All right, how's everybody doing out there today? Look at it. Who we got? Got my cousin Randall's out there. What's going on? Mr. Smith. All right, Myra, Larry, how you doing out there? Hope you're staying safe. Lewis is in the building. Okay, good stuff. Good stuff. That's what I'm seeing there. Good stuff. All right, a little interruption with the video, but we are going. Checking everybody that's out there. Good stuff. Ashley and Kira got a few more people that have joined, so thank you guys for joining. All right, we'll get it going. So thank you for coming back to the town hall this evening. We had some technical difficulties yesterday, but we got everything up and going. It looks like everything's working well with the stream. I will start off and welcome everybody. Again, this is part of some town halls we want to do this month to make sure that everybody continues to be informed and everything continues to work well, and make sure everybody's informed, and that we move through this as quickly as possible. Again, the short and long-term impact both depend on how well we follow guidance that we're receiving from the CDC at the national and local level. And so there's been some updates in the past couple of days, obviously here in the 9th District, so I want to make sure we keep everybody posted on that. Also, I want to make sure I introduce myself as we're starting this off. Again, my name is Corey Strong. I am candidate for U.S. House here in the Tennessee's 9th District. And a little bit about our platform straight up is one theme to our platform is we want to bring better jobs to the city of Memphis, to the 9th District, and to the 901. We have some very, very talented, amazing people here in Memphis, but it's time for Memphis to grow up and grow out. We need better jobs. We need more diverse jobs, and it's time for Memphis to grow. And the only way we grow is by investing in all the members of all our communities. The only way this happens. And so I believe that the 901 is strong and that its number one resources is people. And we have to invest in those people in order to make this work. And so I want to be that advocate at the congressional level, that national representative that says, hey, Memphis is the place that you want to be. And the people of Memphis are who you want to invest in at every level. Support our mayor, support our chamber, support our businesses, and make sure that Memphis in the 9th District is a place that people want to be. So that's awesome. So we're meant to have a guest for our town hall this evening. Unfortunately, our guest is in the middle of a response in the city of Denver. And so the guest who we're supposed to have this evening is Danny Glover. And very unfortunate, he was here yesterday evening, but couldn't be here this evening. He is tasked, he is a part of the virus response unit that the mayor of Denver has up there. He's also a special assistant to the mayor, works in community outreach. And so he is tasked with supporting that effort there. And so he could not make it because they are trying to make some changes. They're looking at data just like we're doing here in Tennessee, and that's super important work that he's doing. And so sorry he couldn't be here. We'll try to get him on later again this month and get an opportunity to talk to him. But again, this is affecting us all over the country. So that's just another example of the fact that this is ever changing. It moves, it changes every moment. And you have to have all hands on deck, really smart people. Leadership is super important in areas like that. So glad that Danny's in a place where leadership is strong and being proactive to reduce the numbers. So one of the things I wanted to talk about is just kind of coronavirus here locally. I know that we saw some leadership from our mayor to really get involved to make sure that people were staying away from parks and make sure that people were staying inside. And so we got two updates. Tennessee and Mississippi were two of the last states that did not have stay-at-home orders, and they have resolved those yesterday for Mississippi and today in Tennessee. So that is demonstrating that this is going and a uniform response from all the states. And so that is super important that a state of Tennessee has finally shown up. And so I know, shout out to all of the Democratic officials that we had at the state level that really pushed our governor to do that. And so I know Antonio Parkinson, Leader Camper, Senator Akbari, and then as well as a host of other people worked really hard to push our governor to do the right thing. He finally has done that to make sure that people are taking this seriously. Mississippi did it yesterday, and I saw some stats that came out today from Mississippi that Mississippi actually has the highest rate of hospitalizations for coronavirus. And so they don't have the same number of people that actually contracted it, but some 31 or 32% of people that have contracted coronavirus in the state of Mississippi are actually being hospitalized. And that's a demonstration of how serious this can be. And as the hospitals get maxed and stressed, it is important that we're not only supporting healthcare workers and in spirit and make sure they have the right supplies and things they need, but we're supporting them in what we're doing by staying at home and making sure that the virus is not spreading. So how's it affecting Shelby County? Obviously, I had an opportunity last week to be at the Croc Center, a part of the MIFA handout. And so we handed out food to those who are in need, and really shout out to MIFA and the Croc Center and the Salvation Army and the whole team over there for what the work they're doing. I was invited by 100 Black men in Memphis, and so thanks to Daryl Cobbins for that invitation. So that was huge to be able to do a little bit. Obviously, we practiced, wore our masks, wore our gloves, and everything we're supposed to do there. But those lines are pretty significant. And if you look at anywhere you've been on social media, this is having a heavy impact, not just because of the sickness, but because of people staying at home. Again, Memphis in the 9th District, one of the most impoverished congressional districts, one of the most impoverished major cities in the country. And so people not being able to go to work and not being able to be mobile and make ends meet is affecting them just simply having food to eat. And so that is far-reaching, is touching every neighborhood, every community. Working at Shelby County Schools, that continues to be an issue as well for our students to make sure that not only continue their education, but that they have food as well. Nearly 40% of our students live in poverty, right? And so without having the right nutrition and access to food, again, the stay at home is affecting a lot of people. And so it appears that we are still on the uptick here in Shelby County. And so show some leadership at the mayoral level, Mayor Strickland, for shutting down some access to the parks to make sure that people are staying at home. So that's huge. And people really, really got to take it seriously. And this is going to take some leadership, not only from parents, but also with our children. I see a lot of youth that are out. And so parents are going to have to be strong and really, really, really enforce some of these rules with some of our kids and our young adults to stay at home. That's super, super important. As you drive through some of the neighborhoods, you're still seeing some of the same issues in some of the parks and other places. And yeah, in some cases, they're taking out basketball goals. I got it. But unless we are actually, as a community, uniformly enforcing this order, some leadership is going to come from the governor and from the president and from the mayor, but some of it in our communities, we're going to have to be those leaders. We're going to have to be 901 strong and tell people to stay at home and really participate this in a real way. And so I think that's good. Again, just to make sure that people are aware of testing locations. And so the testing locations here, all of the testing locations for Christ Community Health are open. And so that's a huge one. So anywhere that Christ Community Health is, those are testing locations. In addition to that, there's a drive-through testing location for let me pull up the graphic. Drive-through testing location at, and actually I'm going to display this graphic on the screen so that everybody gets the opportunity to see it, because I think that is important. People know where they go. And I'll talk a little bit about it once we get there. Let me pull that graphic up real quick. I'll make sure we pull it up. Okay, got this other graphic. Hold on, just give me a second. And this was actually put out by our county commissioners, which is a good graphic of it, where everybody is going to, where everybody should be going to get tested. Give me just a second. There we go. So there we go. So you should be able to see that there. So our testing locations, so all the Christ Community Health clinics, and those are all around the city. You also have Baptist Hospital. Tiger Lane at the Fairgrounds is another location, and Methodist Hospital, University of Germantown North and South. I think what's important to understand about the testing locations at the Christ Community Health Clinic and at Tiger Lane, at those two on the top left and the top right, the most important thing for those is to ensure that you have an appointment and that you've called ahead. So make sure that you are having symptoms before you call one of those locations. For Baptist Hospital, Methodist Hospital, obviously hospitals open all day and they're prepared to receive people, but make sure your test, make sure if you don't have an appointment or if you've not been registered and you're feeling symptoms, either Baptist or Methodist hospitals, any of those locations. And they are taking a lot of people. Speaking to a friend of mine who works at both of those hospitals, they're definitely getting hit and getting their fair share of people that are coming to those. But if you don't have an appointment and or not unable to make an appointment or need to take somebody there, those are two places for you to check out, which are at Tiger Lane at the Fairgrounds and at either of the Christ Community Health Clinics. So super important, make sure that you're there and take care of that. Wanted to bring up another graph that talks about kind of what's going on here. And I know a lot of people, some people have seen this, but I think it's good to put it up there so people are aware of what's going on here. So if you look at this photo, and this was as of a few days ago, so it's a few days old. Let me see. There we go. Got it. So this is a few days old, but if you look at this actual, it tells you, shows you some of the hot spots that we have in the city. I think an important thing to look at in reference to some of the hotspots is, and this is something that we have to continue to tackle here in the night, and this is super important, is if you look at some of the hotspots, you see East Memphis, and you're starting to see some pop up in like Whitehaven, and some in downtown North Memphis, some in Hickory Hill, Parkway Village. If you looked at this map a couple of days ago, you would not have seen those. A lot of those areas would have been green, and I think this is a reflection of testing, which means, and this is one of the things that I want to tackle going to the Congress, is to make sure that we have a uniform, universal healthcare system. People not being able to get, part of it was the response from the from our federal government in making testing available. But if you remember, the first testing location in Shelby County was out in Arlington, which was only based off of the ability of some people to pay to go to it. And the testing came late to some of our communities, more impoverished communities. And I think this is a reflection of, now that testing's gone around the county, that we're seeing where it's affected throughout. We can't continue to have unequal outcomes in healthcare based off of zip code. And I think this map, and comparing it to a few days ago, is a good example of what happens, and particularly in a pandemic like this, where everybody can be affected, anybody can be affected, and it's everywhere, that there's unequal outcomes based off of your ability to pay for healthcare. And so that is something that I definitely want to address. I know there's a lot of effort towards a Medicare for All system. I think that's the direction we're going to go as a country. I think that's, but we have to have a path there that makes sense, that's fiscally responsible, and that has everybody in support of it before we go in that direction. But we don't have a universal healthcare system, and I think that's pretty clear by our response to this virus. And having a national healthcare system that can respond to things like this, not just in pandemics, but on normal day-to-day operations, is super important. So as a general matter, though, I think it's pretty clear where we are in Tennessee. We finally, heed the call of the rest of the country. It's important to stay at home. It's important to stay in place. I think that's super important. So yeah. Second thing is family and resources that are available to me, my friends, family, and businesses. Obviously, at the national level, we have made the relief package was passed by Congress. And so we got $2 trillion out there. I really would like to bring up one more graph that shows kind of where the I guess I can't show that file quite yet. I will have to pull that file up later to show that one in the folder. But I can just read from the actual file itself. So $2 trillion was passed in the act. Where did that money go? And where are we at? So about 600 billion of that money went to individuals, and this is unemployment payments, the cash payments that are coming out, and it looks like it's delayed for a lot of people. If you don't have IRS, you have everything you need there. A direct deposit is going to be delayed getting to you, and also some student loan relief. 425 billion went to loans for corporations. It's about 500 billion went to corporations. About 80 billion went to small businesses. We had another 340 billion went to state and local government, and then another 180 billion that went to public services. And so that includes hospitals, and particularly this is really mostly the money needed that was asked for to make sure the hospitals had what they needed to do to respond. What I would also like to say is that I'm really proud of the 901 and proud of Memphis. I've seen several examples of relief funds that are going directly to, particularly in the restaurant industry. But what I would also say is that a lot of these cases that people are looking for opportunities to donate to a particular fund. I would like to liken this to some of the work that I see people doing for individuals that need food or need resources and aren't mobile to get out. So I saw some examples. For instance, at the end of the MIFA pickup, there was a small amount of food that was left over. All the team and everybody that huddled after the pickup, all the cars had driven through to put those into baskets, and everybody there knew someone who was immobile or might potentially need some type of food. I see a lot of these GoFundMe's, which I think are super important. I know a lot of business owners have had to lay people off, and that's super important. But I think we can all also look at our own families, our own personal networks, our own church networks, and identify people that need food, need resources, um, and help provide those resources for those people. And so I know plenty of people in restaurants are laid off, and dry cleaners or other service industries, people that have reduced the number of people working, laid some people off. Everybody knows someone that's been, or a lot of people know someone that's been furloughed. And so trying to find those opportunities, someone close to you and doing that. I am confident in Memphis because that's who we've always been. I think one of my goals as congressman is to put fewer people in that category. I want less people that are in need like they are currently. But to the degree that you can actually put your hands on someone and provide them with resources, I think that's the best way. That's the easiest way to do that. There's a lot of people, and I really want us to make sure that we're checking in with our elderly population. This is a very lonely time. I'm seeing a lot of people showing up. What's up, Kelly? My boy Sean checked in. Jacoby, Sarita, how's everybody going? So good stuff all around there. So anyways, yeah. So making sure that you are working with some of those elderly people that are shut in, don't necessarily have the resources that they need, touching someone closest to you. I saw that happen out on Monday. If everybody think of someone, send a text, do you know someone in need, and actually providing that resource. You can do it directly. It's going to have the strongest impact, and I think that's super, super important. One of the questions that we got online was, what type of support formally doing the best we can to slow the spread of the virus and just to stop the curve, right? I think that is the most important thing that you can be doing right now. If you could be doing that, that's huge. And I think everybody needs to be in a place where they're doing that. I think the second thing, though, is we need to be identifying the populations that are most in need and making sure that we're serving those populations. I've seen a lot of people talking about we've allowed some the city's taken some steps as far as utility bills are concerned, but also freezing rents and later payments for utilities is something that you should definitely be looking at. We have a lot of citizens in Memphis who are super sensitive to things like this. I think if you saw, there's plenty of articles going about this, that a $500 emergency would affect most Americans, right? And so there's plenty of research that establishes that issue. That's not just a national thing. That is particularly problematic here in Memphis. There's a lot of people that don't have the money in the bank to be able to respond to emergencies, particularly one like this. And so I think it's super important that we do what we can to make sure that we support those. But at the national level, one of the things that I'm looking at and thinking about right now is not just how do we address this in the short term, but how do we address this in the long term? And so first of all, yeah, we have to make sure that small businesses are in a situation where they're taken care of, that large corporations will cover for this. But my first priority is to make sure that individuals have what they need. And right now, this is shining a glaring light on how many people we have in this country who have healthcare, right? Like, that's the biggest deal. Whatever we can do to make sure that people have healthcare and we're able to respond to this, that people don't have to wonder about whether or not they have ability to pay for a test when something like this comes out. Another thing is I wanted to talk about in reference to responses from officials is this. If you look at the CARES Act makes sure that everyone can get a test for free, right? Which is great. So you can go through one of your drive-through clinics, you can drive up, you can get a test, it's free. I think that is great. That's a necessity. The only way we're going to get over this is by identifying who has it, make sure they're quarantined, make sure they're treated. But you know what's not covered? Any other tests that you receive. This is a respiratory virus, so there's an x-ray. Any other treatments that you're required that you may receive in the hospital, none of that is covered. So right now, there are a lot of people in hospitals that are racking up huge medical bills because this is an urgent virus that we must address. And then what's happening? They're going to be in the same situation, particularly those in Memphis. We are the bankruptcy capital of this country, right? So we have people that are in bankruptcy and they're going to bankruptcy. What's the number one cause of bankruptcy? Medical bills, right? Now we have people going to bankruptcy in Memphis for the other things that are happening here as well to pay their bills. And a lot of people saw the ProPublica article that discussed bankruptcy in Memphis and those issues. And so bankruptcy protections, I think, are super important, but making sure that people don't get in a situation where bankruptcy is their only option. And so by passing the CARES Act, I think that is a great thing. I think the next thing Congress needs to address is to make sure that there is some healthcare patch for people that have been affected by this virus so they are not accumulating medical bills in this emergent situation. And whatever you determine is necessary for that, that needs to be a long-term solution, right? And so, yes, Obamacare is super important, but we got to do a little bit more than that to make sure that people have what they need. And so, super hard, super awesome. Looks like my cousin Key and her family's on from Mumford, Tennessee. So y'all know my family's from Tipton County. So they logging on all the way from Tipton County. So I hope you guys are safe out there. Appreciate y'all logging in. That's super awesome. So awesome. What else? What else we got going? Had another question that came in online yesterday. I wanted to make sure answer some of the questions that we got yesterday. We got some pretty good ones. And so this is taking a little bit off the beaten path of COVID, and I think that's worthwhile. What I think what's important is right now, you see a lot of the watch parties are saying, hey, this is a COVID-free zone. And so I saw the shout out to Momentum, nonprofit partner this year. They're doing a happy hour tonight and tomorrow night. And they said, this is a COVID-free zone. So we're going to talk about something other than the coronavirus. And I think that's important to keep people's morale up. But how would you as Congressman address issues of transportation inequality in Memphis and cities like it, given many economists say that the access to good transit is the single best way to improve a community's economic outlook? So first of all, I want to really applaud the work that Shelby County Mayor Lee Harris and the County Commission and other local officials are doing to make sure that we have transit here in Shelby County. I know that there's been a lot of hand-wringing about how it is that we pay for that. But I think there needs to be a bigger call. At the same time that we were working on that, you see a city, Kansas City, Missouri, that's a similar size to Memphis, similar demographics, that made their transit completely free, right? And so when you see other cities that are doing things like that to improve the prospects of their population, particularly their impoverished population that needs to use public transit, you see a city that is trying to position itself in such a way to attract businesses. And I think one of the things to talk about as Memphis is, hey, how do we improve the situation for for inequality for those that have transportation inequality? And I think that's an important framing of the question. One of the things I think about as a potential advocate and congressman for the city is, how do I improve the entire perception of Memphis? How do I put Memphis in a place where people look at Memphis, people look at the 9th District and say, that's a place that I want to be. That's a place that's on the rise. That's a place on the move. And we need to look at transit as one of those levers that we can pull in order to do that. My opponent has been on the Transportation Committee for some time in Congress, and we've seen some money and resources come this direction. I don't think it's the type of money that someone of that tenure could potentially have brought to Memphis, and I certainly don't think it in some way or another in public transit. I also think that our public transit perspective needs to be is a little bit more aggressive. We're talking about our bus lines, and I think the bus lines are important, but we need to be willing to invest even in rail, right? I remember going out to Denver a few years back, and they invested in light rail recently. It's just to move back and forth from the airport to the city. The airport's they invested in light rail. And so even without a tremendous amount of federal, district is the centerpiece for people start looking at us for leadership. And you see a different Memphis, you see a different Shelby County, you see a different West Tennessee, the nucleus of that change. And so, yeah, income inequality is super important. I don't think you change that. Checking with my guys to make sure there's no other questions. Again, if you guys have questions, feel free to log in, ask whatever questions you may have. Another thing that we're working on, I just want to make sure I announce is this. And so, yeah, we have some cool stuff planned on a daily basis just to check in with you guys. We got a fitness. Check out the page, like it. We'll be putting out some content every. Shout out, coworker Tiffany came through. My boy Eric's on here. So they're still open. Are doing an awesome job to make sure that they are in. They're doing some social distancing in our yard. People are going to drive by her street and wish her a happy birthday. So we've seen today we'll have another